Good afternoon, everyone. I think we're getting ready to get started here. So first thing I want to do is say thank you for joining us this afternoon. My name is Marshall Hayes. I'm the Director of Development at Vaccinate Your Family. And I think I speak for all of us when I say we are very, very excited to have you join us today. We think we've got some interesting things to talk about, and we encourage you to participate in the conversation. I do have to start off on a sad note. Dr. Wardle, Claire Wardle, who was supposed to be one of our panelists today, will not be able to join us. Unfortunately, she has come down with COVID, and she's very sorry that she won't be able to join us today. But on the bright side, we are very fortunate that we were able to find someone to step in who is eminently qualified, and her name is Najma Roberts, and she'll get more of a formal introduction as we get into the presentation. So I guess where I want to start is, I want you to understand today is going to be more of a conversation than a presentation. You're not going to see any graphs. You're not going to see statistics, excuse me, no PowerPoint. This is really more of us talking about where Vaccinate Your Family comes from, where we are right now, and where we want to go in the next couple of years. But most importantly, we want to talk about how what we do overlaps with the types of things that your organizations are doing. That's really what we want to talk about today. So to kick us off, I would like to introduce Amy Pisani. Amy is the CEO of Vaccinate Your Family. She has worked in the vaccine space for over 30 years. 27 of those years have been as the director, the leader of Vaccinate Your Family. So obviously she started when she was quite young. Amy is known far and wide for her tireless efforts in terms of vaccine advocacy, access, equity, and affordability. She has helped draft legislation. She's provided guidance to over 5 different administrations. She's testified before Congress. She's developed campaigns that have educated hundreds of millions of people worldwide. She's done so many things that I can't talk about all of them right now. We'd run out of time. So without further ado, I'm going to hand it over to Amy.
Thanks, Marshall. And I'm really excited about today. You know, I love to talk about Vaccinate Your Family and how we started. I have been here a long time. It's been almost 30 years. I'm on my 27th year with the organization. I can't talk about Vaccinate Your Family without mentioning that we were formerly called Every Child by Two. And a lot of the work that we did was during those years. And it's the type of work that has changed the shape of the immunization infrastructure in our nation. And it is really, truly due to our founders. And so I just want to talk a little bit about what it was like all those many years ago and how it is that we came to where we are today. And so many wonderful things have happened in this nation with regard to vaccines and the opportunities that we have. And I mean, even during the pandemic, as much as it was a really scary time, the delivery system was there and the infrastructure was there. And there's a reason for that. And let me just tell you a little bit about what started our organization. So our founders, of course, are former First Lady Rosalynn Carter and former First Lady of Arkansas, Betty Bumpers. And these two women began working on immunizations, you know, back in the 60s and 70s. Now, the way that story goes, Rosalynn loves to tell the story about Betty. Betty was a school teacher, and she obviously grew up in a really small town in Arkansas. And as she was, you know, teaching her students, she noticed that several of them had died of whooping cough, diphtheria, polio. There were 5 students alone in her little school that died of polio. And it really had an impact on her because Betty had grown up with a mother who was very public health oriented. She taught her to wash the dishes and always pour boiling water over them when they were finished. She taught them about the importance of hand washing. So all of these kinds of interventions that her mother was teaching her really set her up for a lifetime of public health. And so when Betty's husband became the governor of Arkansas, she was really starting to wonder, like, how can I implement the changes that I saw happen in my small community? How can I save the children of Arkansas? And fortunately, the Centers for Disease Control came to her and asked her if she would work on immunizations. They had really, really low immunization rates at the time. It was like 20th percentile. So that's what she did. Betty thought to herself, who is it that can help us with the children in Arkansas? And her mind automatically went to the agricultural extension workers. She tells a story, you know, that they're in every town and everywhere in America. So she went to the agricultural extension workers, and then she went to the nurses, and she went to the mayors and the local businesses and the junior league and the Kiwanis and the Rotarians. And they started working on vaccinating the kids in Arkansas. And within 2 years, they were up to the 70th percentile. So the CDC was astounded, and they said, well, can you help bring other first ladies on board and get them interested in this topic? And of course, Betty took on that challenge like a champion. So she would go to the first ladies during the governor's meetings. And I don't know if you know, but the first ladies, now the spouses, of course, they meet while the governors are meeting at the governor's conferences, and they talk about issues. And so Rosalind loves like to recall how she remembered meeting Betty and how Betty was so passionate. And so Rosalind started working on vaccines in Georgia as a first lady of Georgia. And so the two of them were doing their own thing. Fast forward a couple of years, now Betty is in Washington, D.C., and Dale Bumpers has become senator, which he actually remained a senator for 24 years. So Betty's trying at the federal level to get people interested in vaccines, and it was like no interest at all. And then they tell the most hilarious stories, Betty and Rosalind. So next thing you know, Jimmy is in the office, and Rosalind says they get a knock on the White House door, and it's Betty. And she's literally the first person to ask them for something. And Betty loves to tell the story. She just wanted to see inside the White House, but that wasn't true. So Betty and Rosa went to work. They started working with the Secretary of Health, Education, and Welfare. That's now HHS. That was Joseph Califano back then. And they did a huge influx of federal funds, a focus on immunizations. It was very bipartisan. They had folks working from all sides, because everyone is touched by vaccines. And so that's why it's been such a bipartisan, wonderful place to be. And it's a place that I love to be in, because, you know, whether you're vaccinating your child or, you know, your family member may have had flu, I think that it really helped. Policymakers can really see the beauty of life-saving vaccines. And so they were working on these on policies, and they had real vision, Betty and Rosalind. They weren't, I don't mean to say it in a disparaging way, they weren't just first ladies. They've always been able to see the path through. They were very, their critical thinking skills were beyond measure. And one of the things that they implemented during the Carter administration, which changed the shape of vaccines, were the school laws. When they first started, there were only a couple of states that required school for vaccine entry. And we didn't really know how to get to the children back then in America. There weren't registries, there weren't databases. And so when kids were enrolling for kindergarten, that was the first time people knew where they were. And so they helped pass the laws in every state, and they require vaccines now for school entry. And as that was occurring and all these other initiatives that they were working on, measles stopped happening, and they were celebrating. And Rosalind said that when they left the White House, they thought they had it licked. But unfortunately, there was a really big outbreak of measles, and about 20,000 people got measles, and many of them were children, and several hundred died. And Rosalind basically called up Betty and said, what are we going to do about all these babies that are dying? And then Rosalind went to China on a mission, and in 2 weeks, Betty had an office, a board of directors, which included Dr. Fagey, who I can't say enough about, Dr. Walter Ornstein, who was working in the immunization program in CDC, and so many other wonderful board members, and they started working. And I have to tell you, like, we're not doing slideshows, but I'm going to do a little bit of show and tell. So I've been sleuthing through all of our resources the last couple of years, and I found this press release for when they launched Every Child by Two. And I have to tell you, it like gives me the chills to read this, because I want you to think about the words I'm saying here: long-term policy changes and full vaccination for all. So it talks about in 1991, Rosalind Carter and Betty Bumpers are teaming up to the campaign Every Child by Two, and they seek to get the word out to parents and about the importance of early immunization, and to advocate for long-term policy changes to assure full vaccination for all children by age 2. We're talking about equity and access here. Then they talk about working with the governors and the members of Congress and all the grassroots organization, and to mobilize this coalition, they're going to remove the barriers. Okay, listen to the barriers. The obstacles are accessibility of the clinics, the lack of third-party reimbursement, the high cost of vaccines, And Betty Bumper said, our children ought to be protected at a young age from childhood diseases. It should be a public health matter. So they're going to move forward and they're going to visit in the next 2 months, Pittsburgh, Huntington, West Virginia, Miami, New York, Los Angeles, Chicago, Kansas, Dallas, and Houston. They're going to join with the governor's wives in these states to make immunization of children a top priority. And then they'll be traveling to the Mississippi Delta region. And I love the Mississippi Delta stories because I traveled the world in the country with Betty and Rosalind, and that Mississippi Delta trip, they got a mobile van and they lived in it. They literally went with Erwin Redliner all over the Mississippi Delta region, and they were looking at and trying to figure out what the problems were and trying to develop solutions. And solutions happened. What occurred was more and more people were becoming interested in this, and we were looking at opportunities to, increase affordability and to build coalitions. And in doing that, they started working with new administrations. And that's really kind of when I came on board in 96, Marshall. That's pretty much the time frame that I joined the organization, when they were already doing these visits.
All right, I need to take myself off mute. Amy, that's very interesting, and I know you're very proud. Those of you who may know Amy know that she's very, very proud of our predecessors. But you've been in this business or part of this organization for 27 years. I guess my question for you is, obviously you have a passion for what you do, but what makes the work that you do personal? I mean, what about it keeps you invigorated every day for almost 3 decades now?
Well, vaccines, they save lives. And, Betty once gave me a plaque. It sits on my wall. It says, nothing you ever do for children is wasted. And, in public health, we never know sometimes who we're saving. You never know, but families come to us and they've lost their loved ones. And for us, it's so motivating. And that's why I stayed. And I know it's why many of my colleagues, stay in this. When I started, it's hard to believe it, but there was no internet. The internet was being created, and it's a different world that we live in now, but we were still trying to figure out where to reach the kids. They talked about the barriers of clinic hours. Well, when I came on board, I worked at the American Nurses Association, and Every Child by Two became a program because Betty and Rosalind were always about institutionalization of their efforts. Like, how can they make permanent change? It was always top of mind for them and the board. So they came into the ANA and we started training nurses, and the Academy of Pediatrics was working on medical homes. So while they were training the providers, we were creating, credentialing pieces for the nurses and working hand in hand with all of our partners. And then these amazing policies started happening. The Clintons came into office. Of course, they had had a pretty darn good orientation from 2 other people from Arkansas, Betty and Dale Bumpers. And so Hillary and Bill Clinton had already been working on vaccines in Arkansas. And so it was already in their mindset, like local rule, like how do we access our children? And that's when the Vaccines for Children program was created. And that meant that children no longer had to pay for vaccines if they couldn't afford them. That was a game changer. And the CDC has shown that has saved children from millions of illnesses, and hundreds and thousands of lives have been saved through that program. From that little seed that Betty and Rosalind launched with Vaccines for Children, the state children's health insurance program was created. And through the Bush administration, we were able to sit on those committees at the White House and really talk about, like, how do they implement the CHIP program in a way that is as successful as the immunization program. So Betty and I were so honored to sit on those programs. And then from that, my goodness, we got the Affordability Care Act coverage of vaccines. And this year we're celebrating Medicare and Medicaid coverage. And none of that would have happened had it not have been for all of these pieces and all of these bipartisan policies. And the only other thing I would like to mention, though, just because the world has changed so much, registries were being developed. And so we were finally able to track the kids. So yes, we were having school laws, but that wasn't until they were age 5 that we could find them. Finally, immunization information systems were happening. And so that became a huge priority of our organization. We went to the governors again to ask for funding in Congress, and we literally traveled to all the states all over again. I traveled the whole world with Betty and Rosalind, but every state in the nation as well. And those registries are critical because we were explaining to healthcare executives, this is how you can fix your quality issues. Like, we can help you find the children. And now those registries have adults in them as well. So that was very instrumental to the change. And then the biggest thing, and my favorite program, WIC. Again, our board sat and said, what else can we do? Like, what kids are we still missing? We've got them covered for access, for funding. Like, where can we find the kids that are missing? And they went back to that whole concept of the agricultural extension workers, where Betty was always drilling us with that. And we realized that 7 million pregnant women and children in this country are on WIC at any given time.
Amy,
Like right now, 7 million pregnant women and children.
Tell our audience who, when you say WIC, probably most of them know what WIC means, but maybe just a little background and what that acronym sounds.
Oh, sure. So the USDA implements the WIC program, and that's basically a food and nutrition program for pregnant women and children. And because of Betty and our board and the last executive memorandum signed by Bill Clinton, every single WIC clinic, when they certify a family for their food, they have to bring their immunization records. And they don't hold back their food coupons, of course, never. But they do refer them to a provider if they're not up to date. And that has been an instrumental change. We see the WIC immunization rates are sky high compared to other kids. So those are things that are like really near and dear to my heart, because that's been happening for 20 years now. And we've been, Vaccinate Your Family is so fortunate. We're the ones who educate the WIC programs. We actually go straight to the clients as well. And so those are the big changes that kind of really sparked what was going on. And then I know we're going to talk a little bit about, where we were with the internet, and the other big changes that were occurring back then were, misinformation, disinformation. In order to do that, I really do want to introduce you to Erica, because back then, again, we were working with a powerhouse called APCO Worldwide, a comms firm, which Najma actually also worked for, and Kirsten Thistle is on our board. When APCO Worldwide became a partner with us, they became like an extension to Every Child by Two. And they helped us create an amazing program called Vaccinate Your Baby. And they were passionate. It was like no other comms firm I'd ever worked with. And that's when I met Erica. And there's nobody out there that has, well, maybe equal to me, the passion for vaccines. She's like a sleuth at night. She goes to bed, she puts her kids to bed, and then she starts to sleuth the internet. She will not allow any disinformation to happen without taking action. And so side by side, we started working on educating the Congress and the media and the public. And that's really how I met Erica. And she's got a vision for our future and the future of the vaccines that I think will be of real interest to the folks that are listening today.
Well, thank you, Amy. And to be clear, you trained me on those late nights because I had to stay up and watch Larry King Live. For those of you old enough to remember Larry King Live, interviewing people like Jim Carrey and Jenny McCarthy, et cetera. So those were sort of the good old days. But it's funny, Amy, everybody has their own journey on vaccines. I think one of the things we've always struggled with is how do we make people care about the fact that they got their kids vaccinated and nothing happened? So for me, it was really that opposition research that got me really interested in who are these people trying to undermine and actually harm children. But you actually came to it, my understanding is you came to it through a very different path through your eldest son. I didn't know if you want to talk a little bit about that before we talk about where we're at and where we're headed.
Yeah, sure. Imagine now he's 22. So it was an interesting journey. I was obviously I was new at the organization, creating my own family. And at that time, Andrew Wakefield came on the scene. And a quite pregnant executive director was going to the congressional briefings, and it was alarming to anyone. I mean, we'd already dealt with RSV, with SIDS and like MS, and like we were constantly like whack-a-moling down disinformation. But Andrew Wakefield, I don't know if any of you have ever heard him speak in person. He's extremely charismatic and very believable. So he's up there and Congressman Burton's asking all these questions, and he's got these graphs up on the Hill, and I'm starting to get really nervous. Like, is it possible that this Mercury connection could be true? And I don't really grasp all the science. And so I was so fortunate. And I had this board of directors that included Paul Offit and Walt Ornstein. And I would like ask them all these questions. And they're like, Amy, no, that's not possible because this scientific reason, this mechanism, and this study. And it really got my mind like rolling. Like, it seems unfair that I have access to all this information. And then the next thing I know, I get a call from a woman named Danielle, and Danielle's baby Bree had just died of whooping cough. Danielle found us on the internet. We had created a new website. We were the first on the internet with the vaccine website. And she was heartbroken because her baby died of whooping cough. she went home to bereave and watch a little daytime television. And Oprah Winfrey's interviewing Jenny McCarthy. And she's just spewing all this misinformation. And Danielle didn't know what to do. And she said, she called us and she said, oh my God, what can I do? Like, I really want to help. And at the same time, Paul Offit is talking to a new mom, Amanda Peet, and she's an actress. And he says, look, now that you understand the science, I know an organization that could really use your help. So that's when I worked with Erica and all the folks at APCO, and we created our Vaccinate Your Baby program. And that's when we created our Facebook page, and all of our colleagues started meeting on the page. And the whole entire goal was to bring the science to the public. We had access to it, and we felt like everybody else should have access to it. And that's how it all evolved. And then Vaccinate Your Baby became Vaccinate Your Family, and the journey begins.
Journey begins, exactly. We haven't ended, we've only started. Thank you. And thank you all for being here today. I really appreciate it. I know it's been a slog these last couple of years. I mean, we started with a measles epidemic, then we went straight into a pandemic. I was listening to a podcast for the first time that started in 2019, and it's crazy to hear it relived through that podcast, right? Of, oh, we're going to do live shows. Oh, no, we're not. No, we're not. No, we're not, right? And we wait for another 2 years until we're finally out in the world. So it's been a ride, but you know what? What we hear about time and time again is mis and disinformation online. And as you heard from Amy, we've been dealing with mis and disinformation since 2007, 2008. We were one of the first pro-vaccine groups on Facebook at that time in 2008. So we've seen this evolve. We've tried different interventions. And really what it comes down to at the end of the day is, this isn't a social media problem. As our board member, Dr. Claire Wardle, who unfortunately couldn't be here today, always says, this is a human problem. And what we saw during COVID was what really moves people, really changes the tide, is not their social media interactions, but rather their day-to-day interactions. What are friends saying? What are families saying? What are their reverends saying? People that they trust in the community, teachers, etc. And so at Vaccinate Your Family, we started to really push and change to community engagement, which sounds counterintuitive during a pandemic, right? Because everybody's stuck at home, but it's actually not. So even though there's a surround sound happening on social media, it was still about human interaction at the end of the day. And how can we as an organization better empower those groups at the community level to participate in vaccine conversations? So some of you may have seen, we just recently released our report on community-based organization funding during the pandemic. So the government obviously spent a lot of money over the past two and a half years, understandably, right? We need that. We needed to keep roofs overhead, food on table, etc. So over $1 trillion spent, 1% of which went to community-based organizations on this specific vaccine issue. Now, we all know CBOs can work on a dime. But imagine what they can do with $1 or $10 or, heaven forbid, thousands of dollars, right? So while we want to encourage and change that CBO report the way the federal government funds CBOs and moves that needle, we simultaneously understand that everybody has a role in this. Everybody's got to be at the table. And so that's why I'm so excited to have a conversation with not only my fellow colleagues here at Vaccinate Your Family, but all of you. As Carly just mentioned, if you guys have any questions as we start this conversation, please drop them in the chat. We'll work them in. But I'm so excited to talk to Najma Roberts. So Najma, as Amy said, is a former colleague of mine at APCO Worldwide. And we were lucky enough to bring her on as a consultant a couple of months ago. Or a couple of years ago, sorry, at this point. What is time? Time means nothing in COVID, right? But Najma is an expert. She's a communication strategist, first and foremost. Like there's no comms problem that Najma can't work through. She's also an expert in public health and in democracy issues. But perhaps most importantly to some folks on this call, she's a native Chicagoan as well. I am told it is the best city in the world.
The best. Thank you for that shout out. Yes.
Thank you so much for joining us, Najma. I just wanted to get your perspective on why community engagement is so important.
Well, first, thank you for having me, and thank you for acknowledging that Chicago is indeed the best city in the world. Erica and I go back and forth on this all the time. It is so wonderful to be here. Honestly, I know I am probably, I know I'm a downgrade from Dr. Claire Wardle, so please hang on, folks. I'm not a misinformation expert, but I am excited to have this conversation. One of the things, Erica, to answer your question that Amy just said that really, and I've heard it it over and over again, but it struck a little differently today, saying, looking at Vaccinate Your Family and Every Child by Two, the goal was to bring the science to public. And I think that's right. But I think now we're flipping it on its head, and now we're bringing the community to the science, and we're being deeply rooted in who are the thought leaders. It may be PTO president, it may be faith leaders, it may just be someone on the neighborhood block association. And the reason why community engagement is really important, because people see themselves in the reflections of their neighbors or their peers or moms in the group chat. I know I have 2 children, and I'm always, texting the other moms like, all right, what do we do in this situation? Or who's getting the vaccine when the COVID vaccine first came out? Because you're looking at your peers is like, what is everyone else doing? And that, organizing and packaging that community engagement really does move the needle, because people can see themselves reflected inside of that thought leadership and that advocacy.
Absolutely. And I think, we all want to do community engagement, but I think doing community engagement is a lot harder and a lot more work and a lot more time invested than people realize. So one of the things we've talked a lot about is the importance of listening, and that it's not a one and done thing. So I was wondering if you could tell us a little bit about the process that we've been working on together on how to really bring in feedback in a two-way conversation into public health.
Absolutely. I mean, listening is absolutely the number one thing. Anytime someone says, all right, I want to go to Atlanta and Miami and I want to execute a campaign, the first piece of counsel that I always give is, we need to listen. Do you understand what the dynamics in that community? Do you know who the leaders are? Do you know what the nuance of that community and the culture there? And so by listening, you learn that. I think not only listening, but really thinking about who are the people that already sort of have a seat at the table or can galvanize folks within that community is uber important. And I know when we talk about community engagement, it's not just putting information out there, but it's creating a platform in which people can also give you feedback. And so just like, you released this report on community engagement, we're having this session, we're wanting people to dialogue with us in and outside of this formal briefing, like, hit us up on Facebook, go through all of our social channels, send us an email, set up a one-on-one call so that we can really understand how this information is being received in and outside of specific communities. I love when Amy talks about Rosalyn and Betty going in the Mississippi Delta. I mean, I think getting on a bus, like that is straight up pre-COVID, of course, old school community engagement. And my family comes from a civil rights background, and it makes me think about the stories my dad would tell around the civil rights movement. And it truly is grassroots, door to door. But one of the reasons why dad was successful and Betty and Rosalyn were successful, because they identified people that were already in that community that could be champions of what they were trying to do, champions of the agenda that they were putting forward. And I imagine there was a lot of listening over good peach cobbler and sweet tea, lots of listening there.
Lots of listening, lots of sugar. That's my favorite.
Which is the best way to listen.
Yes, exactly. And I think it's so much more than listening too, right? It's also sharing resources, putting our money. We've done this at Vaccinate Your Family where our mouths are, right? Going in and doing micro grant programs and saying, not only do I want your feedback, do I want your input, but here's money, right? Yes. A lot of times what we found, so we did one in particular in the Pilsen neighborhood of Chicago. So again, this idea of not just going to Chicago, but there's so many different neighborhoods in Chicago. You've got to get really, really specific about who you're trying to reach in order to reach them effectively. But, we went into Pilsen and we took our time. It took several months to make the right introductions, build trust within the community, and then say, you know how to do this best. Oh, and by the way, you guys have been doing this, but you haven't been compensated for your time in doing this, right? So I think that's one thing. The other thing that strikes me too is the need to make this part of the agenda, right? So we've worked with Good Health Wins, one of our partners with NCNW. They've managed in many of their chapters and sections to merge this idea of vaccines, voting, and sometimes even good eating, veggies, right? How does that happen? How does that all come together? And how do you make your cause, or our cause in this case, vaccines, a part of the broader conversation of what people really need to thrive.
Absolutely. And Amy, I mean, I think you and I were together at that panel, so feel free to chime in here. I mean, I think when you look at vaccine equity, it's civil rights, right? It's making sure that people have the ability to live a fully healthy, disease-free life, and the way that your neighbor has the same access, or the people on the north side of Chicago have similar access, people on the south side should. And one of the ways that we look at why it's important to come together to do that work, one, everyone has a role to play. And Erica, you and I talk about this all the time, whether it's government, whether it's the private sector, whether it's individuals, everyone has a role to play. And when you think about that role, when you think about how we think about civil rights, how you think about voting, how you think about all the things that impact our society, vaccine access and equity is right up there. And making sure you're making that connection is important because, again, vaccine equity, civil rights, all of that does come together, and we are all working towards sort of a common goal there. I don't know, Amy, we were in that session. Anything that you wanted to bring in?
Naj was talking about, we went to the Congressional Black Caucus last week, and it was, I actually got teared up at the session. I wasn't speaking at the session, I was in the audience, but it was like everybody, and I know everybody on this webinar cares about vaccines as much as we do. It was like a community who we've been always hoping to make change with, that are so inspired now and like ready to go. And it just, for me, I felt like it's true. If you don't get a child vaccinated or a pregnant mom like on time, they'll never be in the system properly, in the healthcare system. Like, that's what builds trust. When you offer something like that, essential life-saving medication to a mom and she accepts it, that sets them on a course for an entire life of health, not just from vaccine preventable diseases, but for everything. So I do believe that access and equals, equity and access are equal. And one other thing I'd mention is, my experiences with Betty and Roseland, I was so fortunate. I went to urban areas, to rural areas. We would travel to the lowest immunization rates. People always like, oh, you're so lucky you get to travel, you go to some beautiful places. No, we were going where the biggest problems were. But it was so beautiful because everybody was there, really cared and wanted to make a difference. And it was exactly like you said, Najma, we weren't telling them what to do. We were offering them our assistance, or Erica, we were giving microgrants to school-based health centers. That was like one of my favorite programs. We were offering microgrants to school-based health centers to set up immunization clinics. So it's great to see like this conversation, because it's all going back to our roots, but we're changing it for the future.
Yeah, I think the other thing that's important, Erica, that, we talk about is equipping communities to be able to do this work. Think about when the COVID vaccine first came out. There were so many people that were like, I'm not taking that. The pharmaceutical industry is trying to kill Black people, and it's, putting chips in our heads and all that. But imagine if you have every PTO president of your kid's school, and your faith leader, maybe your sorority or your fraternity that's like, I took it, I'm good, we are going to save lives by doing that, and starting to be the champions and the advocates within the community. And that's what we know works, right? It's not about someone sort of making mandates from the ivory tower, but it is equipping individual communities to be able to say, I know what works. I know that, if we do dinner, Sunday soul food dinner, and I invite 30 people to my home, and we're going to have, sweet tea and peach cobbler and talk about getting vaccine, and there's going to be a clinic on Monday, that people are going to trust that, because again, you're using the people that are already inside the community, and the nuance that comes with that, the ability to be culturally competent and speak the language and understand the dialect, all of that is really important. Like, I'm from Chicago, so we say pop, we don't say soda. It took me forever to know what soda was. And little things like that. If I go to Chicago, I'm like, can I have a soda? They're like, oh yeah, she's definitely not from here. Get her soda and get her out of here. But when you really find mechanisms to relate to people that are, and you can't just say Chicago, like you said, Erica, there are little mini pot, and they're all different. and equipping these leaders that are doing it anyway, that have been doing it for years, that are setting up, vaccine clinics and voter registration drives. They're literally doing all these things. And it is the responsibility of those of us with privilege, whether it be resources or thought leadership or influence, to be able to give the communities that are doing this the resources they need to do it more and go deeper and go better.
Yes, thank you. They're already doing it and have been doing it for years because no one's going to do it for them, right? And so when we look at who still isn't vaccinated against COVID, who still needs access to routine vaccines, right? It's not the entire population. I think it can be really easy for us to get distracted by social media, by the naysayers, right? But I want you to think about those lines we saw outside of clinics in January and February of 2021, right? I want you to look at the data and see just how many people got vaccinated, right? I compare it actually to the polio campaigns. I looked at the data. We're at or above polio vaccine campaign numbers. Think about that, right? The thing we hold up, right? Everybody wanted a polio vaccine. Guess what? Almost everybody wanted a COVID vaccine too. So that's why it's so important too for us to pause and really think about the communities we're trying to reach and pull these communities apart because they're not monoliths, right? We hear all the time about African Americans, Latinas, rural communities. That one label is so minimalizing to the communities and the richness in each of those communities. And so actually one of our board members, Dr. Nadine Gracia, who's also the CEO of Trust for America's Health, she always says, when you've seen one community, you've seen one community, right? And so this is a lot of work to get into every single community that we need to, but by really narrowing it down, by all of us taking a look at our work, our privileges, our ability to contribute, we can really start to pick apart where can we make true differences. I do just want to talk about mis and disinformation for a moment, though, because it is still out there. There's been a lot of great work done. Deplatforming worked, right? Several groups and individuals were deplatformed. It is now harder to find mis and disinformation as a result of that. Now it's word of mouth. And so I want to talk a little bit about a really interesting pre-COVID study about Twitter. People who were exposed to misinformation about the flu vaccine on Twitter ultimately made their decision based on the conversations they had with people they knew in real life, right? So I just want to get your reactions to that. It seems to me, yes, we need to hold the line on social media, but it seems to me that's not the be all and end all. It really is still these real life connections that we have.
Yeah, I would say, for me and Mike, we have something we call the mom group chat. Like we literally labeled it the mom group chat. And anytime anything on the news hits around vaccines or like when we were really scared to go anywhere for COVID and all the kids were behind in physicals, it was like, hey guys, what are we doing about physicals this year? I think that community, that what so you call the group chat community, or who you're going to brunch with or who you're talking to in the evenings, that community has more influence than Facebook and Twitter ever can. I think what the platforms do is it elevates these issues. And so you're going to hear about them. You're going to hear, the mis and disinformation, and it's another conversation around what, their responsibility is. But for now, we'll stick with the subject at hand. There are going to constantly be themes around mis and disinformation around any issue area, whether it's vaccine, whether it's like, is our tap water good enough? Should we, climate, all the things. And this is why it's really important to resource community engagement, so that we know it's going to happen, but so that when it happens, we have armed these communities, these groups, whether it's faith groups, whether it's, whatever it is, to be able to fight against it. Because we alone, those on the call alone, can't do it. But what we can do is find our place of privilege, be able to resource these groups so that when it happens, there's already a sort of a defense strategy or a proactive, even offense strategy, that when it hits, it's like, oh yeah, I knew that was coming, because we've got, we're having a meeting on vaccines now. Is, we're combining that with, registering to vote and, recycle day on Thursday. Like, this is how you do it. This is how you move the needle. I don't know, Amy, what do you think?
No, I absolutely, I completely concur with what you're saying. And I think that the beauty of social media, as much as we all dove in, head first, that was one of the things that we felt really strongly about. And what I love most about like the good, the bad, and the ugly, the great, is the fact that we met so many vaccine advocates on our Facebook page. We started Vaccinate Your Baby, which we then changed to Vaccinate Your Family because people's kids were growing up. We're like, well, we have to grow up with them. But that's how we met people like Karen Ernst, right? And Nathan Boonstra and Dorit Rice. They were literally commenting in our comments. And so we all became a part of a community. And those communities created their own private groups. And they went out and sleuthed the internet. I don't care if it was social media or the internet, and just fought disinformation. And so there are great things about it. And there are, and of course there's the downside. But I think if we can just help them like provide the sources of information, then you can have that conversation. I mean, I had to help my sister-in-law just the other day with the common myth that we're always dealing with, but she just like, oh my God, this woman is doing it again. And I'm like, I already told you the answer 3 times this year, but I have to feed it to her in bits that she can then put on the Facebook page. And I think that's part of the challenge.
Yeah. Well, and the fact that she has you as a resource, right? How can we create mini yous? Obviously you're not replicable, but mini yous in every community, right? So that someone says, oh my gosh, I just heard this. And instead of running and telling their neighbor, oh my gosh, did you hear this causes X, Y, and Z? They say, wait a second, let me go ask Amy first, right? Before I start spreading this around so that I'm prepared to respond. Well, yes, Amy, did you want to add something?
Well, I know that's like the perfect reason why we wanted to start the collaborative, which I think you're just about to say, but the collaborative is all about sharing resources with one another.
Exactly. We're right here. No, absolutely. And so, first of all, I want to thank both of you, but I also want to invite the audience. We're going to be moving into a more general discussion. So again, if you have questions, comments for anyone, thoughts on what your organization is doing in the space, we'd very much welcome that. But I do just want to say, yes, it's a lot of work. Yes, it's a lot of time. We have a solution. I'm happy to announce we have a solution. It's called the Vaccination Collaborative. So what we've done is we've taken all the work that's been done for 30 plus years in routine immunizations, and we've combined it with the really amazing work that COVID-19 has reignited. So all of these community-based organizations and individuals who got re-engaged on vaccine issues because of the pandemic, we want to keep them at the table. So the Vaccination Collaborative is a unique opportunity for everybody to join, whether you're an individual, whether you're a CBO, medical professional society, for-profit company, everyone is welcome at this table to share information. We have 3 main priorities. The first is communication. As we've been talking about here with mis and disinformation, making sure everybody's on the same page. What do we need to be telling people? What myths do we need to dispel? What good information about available vaccines do we need to get out? The second is policy. As you've seen from our founders, right? Good policy is absolutely critical to move this issue forward. We're very excited to see Medicare and Medicaid will now be covering in 2023 vaccines at no cost for the first time ever. All recommended vaccines at no cost. It's a huge win. But what about the uninsured, right? Our work is not yet done. And how about all the non-cost barriers that people have to vaccination? Thinking about, the 3 buses somebody has to take in Vegas to get to a health clinic. Thinking about the 3-hour drive that people have to take in rural parts of this country to get to a clinic. There are other barriers that we need to overcome, and good policies can help us get there. And then finally, microgranting, making sure that we're getting money to those community groups so that they can stay at the table. When you've got to deal with issues like affordable housing, food, all those social determinants of health, you need funding to be able to stay at this table. And there's nothing saying that our funding on vaccine access and information can't also support other issues happening in the community. So I'm going to hand it back to Marshall, but thank you so much for your time. Thank you for listening. And I hope to see you at the Vaccination Collaborative.
Thank you, Erica, and thank you to all the panelists. There's so much great information there. I hope our guests are enjoying this as much as I am. A number of things struck me, and I was taking notes, so forgive me if I'm glancing down at my notes, but there are a number of things that you guys mentioned that I want to sort of draw. The first is I was struck by the parallels between what was happening some 40 years ago with our predecessors, with Rosalind and Betty. So many of the things that they were doing then are the same methods that help to build vaccine confidence now. You know, the building of coalitions, establishing partnerships, creating that community level authentic engagement. You know, you guys have all said it, but I'll repeat it because it bears repeating. This is not a one and done. This is not a top down. This is a community-based approach that works. We know it works, and we're embracing that aspect. Again, Erica said it. I'll say it again. We're moving beyond. If you want to put your questions or comments in chat, you can. But if you also just want to raise your hand, Carly is monitoring and will let us know that you have a question or a comment to make.
And I see one, an early one from Ms. Dennis. So heard Erica mention that Medicare and Medicaid vaccines will be offered at no cost beginning next year. Would this mean that there will no longer be a copay for Medicare Part D immunizations? That's correct. So starting January 1st of next year, Medicare will cover all vaccines recommended by ACIP, whether in Part B or D, at no cost to the patient. So shingles, hepatitis vaccines, all of those will now be on the same level as pneumococcal, as flu, and as COVID, which is just amazing. The same thing for Medicaid. It's a little bit later, so it's based on open enrollment periods. Medicaid will happen in October of next year. What's amazing about that is, for those of you who know the Medicaid landscape, there's differences even within states. So each state covers Medicaid vaccines differently, and then plans, MCOs, managed care organization plans within Medicaid, all handle it differently as well. So for the first time ever, we don't have to worry about what kind of Medicaid plan you have, Part B, Part D. Your vaccines are covered at no cost. It's a huge barrier removed for those folks on those particular plans. We still got to tackle uninsured, but I'm going to take my moment of victory here.
Absolutely, as you should, Erica. And let me just point out, as Amy said, you know, what is this an example of? Policy works, right? These seeds were planted decades ago. Work has been done. And now look where we're at. And this is going to save tremendous number of lives. This is going to save untold, you know, hospital visits. You know, so you should absolutely take a victory lap, as everybody involved in that process should. So, and you guys feel free to jump in. I'm going to try and summarize as best I can what I heard you saying. What becomes clear is that there are several pieces to the puzzle, and these pieces need to come together. All right. So obviously, Vaccinate Your Family is one of those pieces, right? Providing, you know, trusted, science-based information and assistance for years. That's a piece of the puzzle. Another piece of the puzzle, as Najma indicated, is the business community. You know, they're providing those life-saving vaccines, or we have organizations, businesses on this call right now who are sort of vaccine adjacent, or maybe they're providing storage systems or transportation systems to keep vaccines safe. So there's all these businesses out there and we overlap, because what we're trying to do overlaps with what you're trying to do. Let's move on to other people on this call. For instance, representatives from foundations. You know, their sole mission in many cases is to promote and support healthier communities, which of course is squarely what we're trying to do as well. And then, as you guys have mentioned many times, the CBOs, the community-based organizations, doing the hard work, the boots on the ground, grassroots level work that has to be done neighborhood by neighborhood. These are the different pieces of the puzzle that have to come together to effectively meet this challenge. And that's the purpose of this call today, was not just to listen to these very interesting people talk, but also to start that conversation with our partners, potential partners in the business community, out there in the foundations, to say, how can we work together? How can we partner? What can we bring to the table that will help you meet your goals? And you're supporting us, and everybody wins, because we come up with higher vaccination rates, healthier neighborhoods, better equity, better affordability, which we just discussed. These are the things that we want to discuss, because each of you businesses, organizations on the call right now, you have various needs, right? Various goals and objectives that you're trying to meet. But we're looking for that point of intersection where what we do overlaps with what you're trying to do. So with that said, I'm gonna ask, are there any other questions, or I'm gonna throw it back to some of my colleagues.
Hey, Marshall, I have another thing about the businesses. One of the things that we saw during the pandemic where the businesses were so amenable to, giving people time off if they had, needed time to get vaccinations, that was critical. And that was something that I'm just really proud of the nation and the world really on that front. That's something that is critically important because, as we've traveled the country, you've seen, some families have to get on a bus. It's cold out. It's winter. They don't have some clinics offer tokens. There's a lot of barriers to immunizations. But also the other great thing that came out of the pandemic, and there were only a few good things because there was an awful lot of hurt happening, were the groups that came to the table. And that's what the Vaccination Collaborative is about today. We finally saw for the first time, whether you were representing an at-risk community or folks who have heart disease, diabetes, like people who are really high risk of the virus, they finally came to an awareness. Oh, wait, someone with heart disease or lung disease is at a higher risk if they get a vaccine preventable disease. And that's what Vaccinate Your Family wants to see continue. Like, it's not just COVID, okay? You're extremely high risk if you get pneumococcal disease or flu. All of these things. And so that's why we really feel so passionate about the collaborative, because we want to keep people at the table, make their jobs easier, but really open up that conversation so that we can really learn what it is that they need instead of it coming again from top down.
And Amy, just building real quick on the business community, and we see it in philanthropy as well. A lot of the organizations that we're eager to partner with or have already partnered with are truly trusted messengers. And so even if your budget doesn't allow to make a pivot in the next 2 weeks and it's a 2023 conversation, let's use your platform, you as certain brands and influencers in not only in the community but regionally as a trusted employer. Let's make sure that you're with the Vaccine Collaborative to be able to understand what are the messages I need to be getting to my employees, and is that time off policy for vaccines something that we're going to continue, and how can I encourage my other for-profit peers to be able to do the same. And so I think that there's a conversation to be had. Certainly resourcing is number one. That's priority, so that we can provide micro grants to the different communities, but also using these platforms with hundreds and thousands of followers and people sort of really looking to brands and trusted institutions as just that, trusted institutions, and making sure you have the proper messaging around health equity, around vaccine, and sort of that also helps dispel mis and disinformation.
Erica, could I ask you to circle back to, you talked about the Vaccine Collaborative. We're very excited about that. But let's get a little more specific. One of the things that we've discussed is, and you mentioned it briefly earlier, this idea of micro grants. So tell us just a little bit about how those work and how some of our partners, possibly in the business community or in the foundation world, could support us in that area.
Sure. So I just first want to say the 3 pillars are equal to Najma's point, right? Communication, policy, microgrants. We can all play a role in all of those. Our voices are equally important with policymakers as well. Some people on this call might have a little more sway with policymakers than others. But again, it's all important. But the microgrants, what we're doing is we're doing an analysis of several communities across the United States, and we're layering a couple of factors in there to figure out which are some good communities to start in. So looking at vaccination rates, of course, but looking at the networks already in place. Do our partners have strong relationships, right? Because we don't want to just go in cold, because who are we, right? Who are we? We need somebody who has strong, warm introductions in these communities. So where can we actually make a meaningful difference? Where can we identify a community that has vaccination rate issue, particularly in routine immunization rates, particularly in children. How can we look at a community and say, okay, this is how we could help with a very strategic influx of cash? And then how can we, as Vaccinate Your Family, help those CBOs access the money? I think what's often lost and what you'll see in the CBO report is those organizations are small, are limited in resources, limited in staff, limited in time. They don't have the time to apply for these giant federal grants. They could easily, listen, give them $1 million, they can spend it. They can spend it well, but they can't apply for it, right? And so how can we also help that flow of money through? Let us handle some of the administration so that they can focus on the work. We still get the reporting requirements in, whatever they need from an administration side, but they can focus on the work and they don't have to worry about the flow of money.
Excellent. And I think that's a very good point. Having worked in social service for the bulk of my career, I can tell you, and having run some, small to medium-sized organizations, we didn't have the resources to do that. We could use the money. We certainly could have done a lot of good with it, but didn't have the infrastructure to apply for it. So that's a role that Vaccinate Your Family can absolutely play. And I see we're getting short on time now. So I guess the way I want to wrap it up is give each of you just 1 minute. If there's one last thing you want to say, and then I'm going to tie this thing together and we'll thank our guests for attending. Let's start with you, Amy.
Well, I want to just highlight the best parts about our nation. We have an amazing infrastructure. We have program managers in every state that are getting vaccines where they need to be. These are all parts of a network that have been developed over 30 years. We've got bipartisan support. We've worked with every administration since I began. Every single Secretary of Health, every presidential administration has been interested in vaccines because they save lives. And so, I mean, for me, I'm just grateful that the companies make life-saving vaccines, and we're going to do everything we can to make sure that every person has access and affordable vaccines. So I'm really grateful to have the folks here today. And thank you to Najma for the last minute. I love working with you.
Thank you, Najma. Let's go to you next.
I would just say everyone on this call is sitting in their seat or standing at their standing desk from a place of privilege, whether that be resources, whether that be influence, the ability to translate complex issues into simple and easy to understand bites. Find your lane, find your place where you are uniquely qualified to help move the needle on this work. And let's work together. We really need you. This work cannot be done in silos, and it can't be done alone. So find that lane.
Thank you, Najma. We'll give Erica the last word.
Well, Najma should have gotten the last word because that was the best word. But all I will say is y'all understand community engagement. Just look at your own community, right? I grew up in central New Jersey. The first thing I said when COVID hit is if I want people to get vaccinated, I'm going to call Reverend Soares at First Baptist Church in Lincoln Gardens and say, please, please, please tell folks this is important. I go home to visit my parents in New Jersey. Who's on the TV? Reverend Soares, right? They heard me. But here in rural Pennsylvania, where I now live, central rural Pennsylvania, it's not a Reverend Soares. It's the gentleman who runs the largest gun store in the area, right? Who got vaccinated, who got COVID because his patrons weren't vaccinated. It's the football coach. It's the wrestling coach, right? So you do understand community engagement by looking at your own communities, and think how frustrated you would be if somebody from the outside came in and tried to apply some, generic map to it, right? So it really is about a community by community. And as Najma says, takes a lot of resources. So let's all work together and figure out this problem community by community.
Thank you very much, Erica. And on that note, I will say this. You guys have all said it. I'll just reiterate. It's about partnerships. It's about working together. It's about moving the needle. I'm going to be reaching out to many of you that are on this call today in the next couple of weeks to follow up, to continue this conversation, because I think it's a very important one to see where we can work together. We also have our annual report coming out, and so I'll send that out to you as well, just to give you an idea of what we've been up to and where we think we're going. But to end, I just want to say thank you very much for joining us. I hope you found this as entertaining and informative as I did. And I want to say also thank you to our panelists. Very, very interesting information.
Thanks everyone for joining us today.